Hi, everybody. Kip Harridge here with the daily VRA investing podcast. A bit of a different podcast today. We're very fortunate to be joined today by Dr. Gavin Yamey from Duke University. Just a quick intro of myself for those who have a lot of new people here, hopefully, here to learn from Dr. Yamey and get some good questions answered that I think, by and large, are not being answered in the mainstream media. And personally speaking, I think that speaks to my frustration that I felt, and I think I speak for a lot of people. So this is going to be a great opportunity to go right to the source and get some great questions answered. Just very quickly, my background's 36 years in the investment business, 15 years on Wall Street. I've had the VRA, our financial publishing business now since 2003. This is coming up on 4 years of podcasts, almost 1,000 podcasts we've done. And we've wanted for the last couple of years to do one about coronavirus. So this is fantastic. Again, welcome everybody. Thank you for joining us here today. Dr. Gavin Yamey, please say hi to everybody.
Thanks so much. Thanks for the opportunity, Kip. I have not been on a podcast quite like this. I know nothing about financial investing or Bitcoin or anything like that, but I'm really looking forward to talking with you and to reaching viewers and listeners, who I don't normally reach. So looking forward to what I hope will be a fact-based, science-based conversation.
I think between your followers on Twitter and your community and mine and the people this is going to reach, I think we have a chance now to really help people get some answers to questions they've had. I think we need a lot more.
I hope so. I hope so. And I acknowledge that, I work in public health. I'm a physician by training. I acknowledge that there are ongoing concerns that people have, questions that they have. This is a pandemic that has been the worst in 100 years. There's been changing knowledge about the virus. How is it transmitted? What are the best ways to prevent it? We're still rolling out the vaccines, and so it's all been happening in a kind of a fog of war, if you like. So if there's a chance today to address some questions or concerns, really happy to do so.
Fantastic. I'm going to give you a proper introduction as well. Just real quick, folks, we've got about 6 topics we want to get to. We only have 45 minutes, a little bit less now. So we're going to go through this fairly quickly. This man has got a phenomenal CV, as you see right here. He's right now currently the founder and director of and professor at Duke University, founder director of the Center for Policy Impact and Global Health. As you see his CV in front of you here, Oxford University, University College of London. This is a guy that, let's just say, we were a little bit different growing up, Dr. Yamey. I went to the Oxford of the South, Sam Houston State University.
Oh yeah,
about an hour north of Houston here. So we have a bit of a different educational background, but I have done what I've done 36 years now. I think I've learned a few things. Obviously, you have as well. So this is a real honor again, folks. Again, we're going to move quickly here. My background, real quick, for those that don't know me, I'm a lifelong independent. I didn't find Trump. Trump found me. That's how I think a lot of people feel about this. We want these vaccines to succeed because Trump, this was, what was it called? Operation Warp Speed, right? This was his baby. I also come from a family of nurses, my mother, my grandmother, my aunt. So Dr. Yamey, I understand what this last 2 years has been like for you and for your profession. You guys don't get, not nearly enough people talk about the stress that you folks have been through in the last couple of years. I can't even imagine it.
Well, I should say it's the frontline workers. I have the privilege, I work in public health and in global public health. As you can see, I have the privilege of working, from an office on policy questions and questions on how you fund the vaccine and how you deliver it. It's really people on the front lines, the nurses, the physical therapists, the doctors, all the frontline providers, and all essential workers, who've been really, at the forefront of this. My sister is a respiratory physical therapist, and she works on a COVID ward. And I know that people are really pretty burnt out, and they've seen wave after wave. As you know, that's the thing about this pandemic, is that it has come in waves. I'm convinced as a physician, as a professor of global public health, that our way out of this is through widespread vaccination. We're not doing enough to vaccinate the world. I hope we'll get to talk about that, the global vaccine inequity. But, you know, I was actually involved in the very earliest effort back in February of last year to start thinking about how we were going to manufacture and finance and deliver the vaccine to the world. So it's been really a remarkable thing to watch. None of us predicted. If I think back to the first meeting, it was at the World Bank in February of last year, I don't think anybody in the room, and it was a room with quite a lot of experts, would have predicted that we would have, you know, a whole range of astoundingly safe, effective vaccines in such a short time. The fastest time in history, the quickest vaccines developed in history. The fastest before was mumps, which took 4 years. We developed vaccines for COVID-19 in under a year. And I know, Kip, that we're going to talk about some of your concerns. I've seen you express them on Twitter. And I wonder whether actually the fact that it was so fast makes some people go, wow, you know, if it was that fast, you know, should we have faith in it? The reality is the technology were behind some of these vaccines were decades and decades in the making. The process by which they were tested was very thorough in large-scale trials. We've now vaccinated literally billions and billions of people, tens of millions of young people, and it remains in the real world absolutely the case that these are astoundingly safe and effective. And I hope we're going to get to chat about that. And I hope we're going to get to chat about childhood vaccines. I have a son. I know you have 2 sons. I know that you and I would do anything for our boys. We want to keep them safe. And I know you've got some questions about that. Our kid has his first dose lined up next week, and he'll have the second dose 3 weeks after. And I hope we can get to, you know, chat about childhood vaccination, which again, I think is an important part of us getting to a place where we can bring this pandemic to a close, return to some kind of normality. I mean, you know, this has been a couple of years now. We're all wanting this to end. And I do think vaccination plus some other measures, as you know, together are going to be required for us to get this, you know, this pandemic to an end. I don't think we're going to be able to eliminate the virus in the United States. I think that we're going to reach a place that's been called endemicity or low endemicity, where we have the virus. It will be among us. I am not in the camp that thinks we can eliminate it, but I think we can drive it down to very low levels.
I apologize. We just limited time here. So
sure.
Again, just to be very, very candid, I feel like people that have watched CNN or MSNBC or even Fox the last year, what you just said, that's the message. That's the message they've heard. But those of us that are on the flip side that have legitimate questions feel like they're not.
Yes.
So let's go to some of those.
Let's dive in. Sure, absolutely. Absolutely. I would say that I wouldn't say that all of the media always tell the story correctly, but let's dive into some of your concerns.
It is the media after all, so we know enough of how that works. Okay, that's a fair statement. So the frontline workers that you mentioned, your family, my family, yourself, so many people that you know, obviously, pretty much everybody in your life. These poor people that have been working on the front lines, many of them now have natural immunity. Why are they having to be vaccinated? I had natural immunity. I had coronavirus 2 years ago.
Good question.
I was one of the first people here in this area to have it.
Yeah.
I just had my body's tested 2 months ago. Why would anybody need to be vaccinated?
Kip, that's a very good question. So let me address that. First of all, I know that there are, you know, some folks who think that the way to get ourselves protected is to get infected, to build so-called natural immunity. The problem with that approach, and I say this somewhat flippantly, and I mean it incredibly, incredibly seriously. The problem with that approach is all the dead people that trying to build. Hold on, let me just.
I'm talking about the 100 million people in the U.S. already that have natural immunity.
No. Let me just finish. There has been an attempt to sort of say that we should just let the virus pass through society and build quote unquote natural immunity. I don't like that term very much. I prefer infection-induced immunity. Natural sort of makes it sound like it's, you know, harmless. The problem with a strategy of deliberately letting the virus pass through society is that it's very deadly. It's the deadliest pandemic in 100 years. you probably saw that piece in The Economist that suggested that we've really been underestimating the deaths. We've probably seen SARS-CoV-2 kill somewhere between 7 and 13 million people. So it's a deadly virus, and so it's risky to try an approach in which it kills so many people, it disables so many people. Perhaps we can get into the debate about how many people end up with long COVID. I have friends with long COVID. It's very disabling. Perhaps 5 to 10% of infected people go on to get long COVID. This is not a benign illness, and we certainly shouldn't be just allowing people to get it, to get the virus. Now,
what about the 100 million?
Let me come back to natural immunity in those who've been infected in the past. It is true. And I think we in the health professional, and here's where I think you and I, Kip, as folks who both love data, can agree. I think it's really absolutely the case that we in the health professional have to acknowledge that there is some immunity that people may have from being infected in the past. But what we really are unclear about is how robust it is, how strong it is, how long it lasts. We know that there are people who have got infected and reinfected with natural immunity. And that is why every scientific organization, from CDC, to the family physicians here, every science organization says that the safest thing to do, the most science-based, the most evidence-based thing to do is to get vaccinated. So I want something very simple, actually. I want the world to get vaccinated to protect themselves. And I think those who are still at risk, we should protect them from infection until they get their shot. Let's give everyone their shot.
Doctor, I really do have to ask you again to be as succinct as possible. And I'm not trying to be combative, but
no, absolutely.
What you're saying is exactly what we've heard on all the networks. What you're saying, you're not I'm sorry, but you're not educating anyone. We know this.
I'm explaining the science. I'm explaining what the data show and what the science show. This is not about my opinion. This is not about your opinion. Your opinion and my opinion are not what we're discussing today.
Science is not settled on this.
So hold on. What we're discussing is the science and the data. Those data clearly are not Republican data. They're not Democratic data. They're not independent data. They're data. And what we know from the data, what we know from the science, I agree with you that those who have been infected in the past will have some immunity, but robust. The science shows that that is not reliable. It is not robust. Necessarily durable. And now we have vaccines that are exquisitely effective and astoundingly safe. And that's why we're trying to offer everybody their shot, everybody their chance to get protected and bring this pandemic to an end.
You're filibustering with the mainstream propaganda. I'm going to ask you, we all know what you're saying. We've heard it so often. Please let me finish. There is no data. There's no data that I've seen that says if you have natural immunity, you're prone to be reinfected. Matter of fact,
no, that's not true, Kit. No, we were having a conversation about the science.
Please, let me finish. I'll let you finish. The Israel study that said if you have natural immunity, you're 25 times more protected than the vaccine is even. What about that data?
And there are other studies to show the opposite. So let me just explain. You're asking me a question. First of all, let's just agree on a few ground rules here. This isn't about filibustering. Filibustering is when you imply that I'm talking so that you can't get a word in edgeways. You've invited me onto this show to talk about science, to talk about data. This isn't a partisan discussion. We are both fathers. We really want the best for our kids and we want the best for society. We're both patriots, we're both Americans. And I would like to say that, as you know, all of the health agencies recommend vaccination because it is the most robust way to ensure that you get protection. And let me just say one thing. The remarkable thing about vaccination is it reduces your chance of getting infection. It reduces transmission to others. If you happen to get infected, it reduces your chances of illness, hospitalization, and death. It is a win, 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 win. And so that is why, look, I have no dog in the race. I've never taken a penny from any pharmaceutical company in my life. I am not on the
Very good.
pay of industry. I come to this as a father, I come to this as a physician, and I come to this as a professor of public health who has read data, understands the data. You're a data guy. I know you know a lot about financial data. I'm a health data guy.
Again, no filibustering, please. Just please make a succinct point because we've got 5 other questions we got to get to here. Okay.
Great.
So
okay, let's go.
What I would say for the frontline workers that are watching this is that have natural immunity. What in the world is going on here? These people they're the healthiest of all people. They should be hired first, not fired. I think it's just unbelievably, it's mean-spirited to the extreme.
Let me explain why health workers are being required to get vaccinated.
No,
okay.
we understand.
No. I'll be very quick. I know you don't want me to say a lot. We have a mandate here at Duke, in the Duke hospitals. You cannot work here unless you're vaccinated against flu, unless you're vaccinated against COVID-19. Even if I don't even go to the hospital, amongst us, the staff and the students, amongst staff and students here, there are people with kidney transplants, rheumatoid arthritis, and other immune conditions. We do not have the right, I think, as health professionals, to transmit the virus onto people and to make them sick. I really think health professionals need to protect their colleagues, protect their patients, and protect society, and vaccination is the way to do that. I'm really convinced, having seen the data and looking at the data on the benefits of vaccination, I really do support the notion that health workers should get vaccinated. Absolutely.
Well,
Let's move on to the next question.
I've got to
in the interest of time.
I've got to say, I think you're stating things on the record that aren't factually true, because we know that if you've been vaccinated.
No, Kip. No, Kip. This is no, Kip. No.
I'm letting you finish.
This is not why you invited me onto the show.
I want to talk for 1 minute. Give me 1 minute to speak. I'm letting you speak. I believe that we've heard from Bill Gates just said this, right? We've heard from the CDC directly that if you're vaccinated, you can get it, you can give it to others, and you can die from it. We see the heaviest populated states and countries that are, as far as being highly vaccinated, look at their case counts are soaring. So clearly something else, the science, something is going on. The science.
There is, sure, let me address that. There is no vaccine that is 100% effective. What is astounding about science and astounding about these vaccines is that they reduce dramatically your chances of getting infected. They reduce transmission of the virus to others, and they dramatically reduce your chance of getting sick, hospitalized, or dying if you get infected. That's why I am vaccinated. That's why my spouse is vaccinated. And that is why our kid will be vaccinated. Right. And those are the facts. And okay. Kip, I really want you to stop saying that I'm not being honest about the data. I'm a professor of global health. No, hold on. This is important.
Not factual.
Kip, we agreed on some ground rules before I came on this show. And those ground rules are that I would share data and I would share the facts. This is not a partisan discussion. This is not a Republican or an independent discussion. You and I, we want the same thing. So that's really an important point. And I want to say one more thing. You would agree though. Let me just say one final thing, which is that the really important one. That, as you know, no doubt about this is a fact. As you know, Kip, and I know, no doubt this is nothing to do with opinion, this is just fact. Vaccinated adolescents are 10 times less likely to be hospitalized than unvaccinated adolescents. That is a fact. Nobody, debates that or has any doubt about that.
Let's move on to that topic.
It's just really important to understand that vaccination is, as you know, the Pope said, Pope Francis, vaccination, he said, Pope Francis, I'm Jewish. I don't know whether you're a religious man, Kip, I'm Jewish. Pope Francis said, vaccination with COVID-19 is an act of love. You are not just protecting yourself, you're protecting your family, you're protecting your community. It's a beautiful thing.
We have to stop the filibuster. We just have to. We've got 5 other topics to get to. On the question of science, the science has changed. You're saying you're dealing in facts here. The science has changed dramatically since these vaccines were first introduced. Remember, at first they said, all you got to do is get the vaccine and you're done. Biden said, you can't get it, you can't give it to other people. We know that's clearly not the case now. The science has clearly changed. The science is not settled. So my question to you is, what happens if we find out in 6 months or a year, or in 2 years, or in 5 or 10, that everything we've been told now was incorrect, because you have to admit, as a man of science, that is possible. That is possible.
Take a look at who is hospitalized and who is dying of COVID-19 today. Take a look, tragically,
very few people.
Take a look where the bodies, Kip, hold on, please stop filibustering me. Take a look where the bodies are piling high. They are in unvaccinated people. If you take a look at who is in hospital, who is getting sick, and who is dying, there is a dramatic difference between those who are vaccinated and those who are unvaccinated. We have a remarkable opportunity, Kip. Do you want this pandemic to end? I really want this pandemic to end. I am tired of it. We are all tired of it. As you know, Kip, hold on, Kip. As you know, 1 in 3 Americans, 1 in 3 Americans knows somebody who has died of COVID-19. I'm sure you do, I do. We have a chance to bring this pandemic to an end. Vaccination is our way forward in doing that. And we still have a huge number of Americans, sadly, who are not yet vaccinated. Are you vaccinated?
Am I vaccinated? I'm fully vaccinated except for this, because I'm a free man. I choose not to be.
Hold on. Are you vaccinated against COVID-19?
Of course not. Absolutely not.
Why are you taking that risk?
I'm a healthy guy. Not the survival rate for people that get it is 99.8%. Why in God's name would I get it?
But that risk that you are taking, that is what I would say.
I had
coronavirus. Hold on.
I had it.
What I would say is you are taking a risk against a virus that we really don't know, everything about.
I have natural immunity.
Are you opposed to people getting vaccinated against COVID-19?
Your body, your choice, baby, all the way. Your body, your choice.
Wait, hold on 1 second. Are you opposed to people getting? Are you opposed to people getting vaccinated against COVID-19?
Absolutely
not. Are you
opposed.
Saying I should not have got vaccinated? My spouse should not have got vaccinated? Is that what you're arguing?
I just said twice. Your body, your choice.
So you are saying it is fine for people to get vaccinated, but you're choosing not to yourself. Okay.
Absolutely.
You're not out there. I hope you're not out there persuading people not to get vaccinated.
Your body, your choice. I can keep saying.
Okay, so you're giving information. For example, I know you want to talk about children. There are 680 kids who have been killed by COVID-19. Children shouldn't die, as you know, Kip. It is the case that children should not die.
But
680 kids. Hold on.
That is not factually true.
There are 680 children who have died from COVID-19.
It's not factually
true. As you know, when you look at other vaccines,
they died with coronavirus.
Hold on. As you know, when you look at other vaccines that were rolled out, as you look at other vaccines that were rolled out, they were rolled out with far fewer numbers of children dying. As you know, Kit, let's just compare it, for example, to flu vaccine. So in a typical flu season, it's horrific to think about, but in a typical flu season, something like 100 kids die of flu, and we're not reaching all of them with flu vaccination. Sadly, we're only reaching about 60% of kids. We could drive that number down if we reach the remaining 40%. So compare that to 680 deaths already in children. We know that over 5,000 kids, sadly, have developed this condition called MIS-C, multisystem inflammatory syndrome. We know that the kids who are hospitalized, as I said, you're 10 times more likely to be hospitalized if you're an adolescent, if you're not vaccinated. A third go on to intensive care. We could be preventing illness and sickness and death in children and adolescents, and helping to protect families and communities. And by the way, also helping to prevent education disruption. And that is why, as you saw, the FDA committee and the CDC committee unanimously approved the vaccine for 5 to 11-year-olds. And as you know, millions of kids have already been vaccinated in the 12 to 17 age group. And, every pediatrician I know, literally, and I know, Kip, I know so many pediatricians, I'm sure you do as well. Every pediatrician I know who has kids, she or he is obviously vaccinating their kids. Every infectious disease expert, every infectious disease epidemiologist, they're vaccinating their kids. And that's why, given all of these benefits. Now, of course,
Dr.
we know
Yamey, Dr. Yamey,
vaccines have
I just
risks.
gave you, you just spoke for 3.5 straight minutes. You have to let me get into some points. Why, instead of you only hogging the call.
Sure, but you asked me about vaccine linkage.
Died with and died from are two very different things. And I think it's irresponsible. I think it's almost medical malpractice to be saying
No, Kip, no, Kip.
Dr. Yamey, let me talk. Let me speak for a minute. I want 1 minute. That's all. I think it's
this is not what we agreed on when you invited me for an interview on your show. You said it would be hold on.
You said the entire time. You want to
non-adversarial. Hold on. You said non-adversarial. You said fact-based. You've just accused me of medical. You just accused me of medical malpractice. This is not a good faith interview. And all the ground rules, Kip, that you lay down, you have just ripped them up. So if you are going to allow me to keep talking about the science and the data and the evidence, we can go on. Will you retract your accusation of medical malpractice? If not, I think this interview is over.
I wasn't speaking about you. I believe there is medical malpractice happening in the medical profession. For example, let me tell you something. I think the Dow Jones is going to 100,000. Okay. And I think it's going to happen within 5 years. I've called it some melt up. I believe I can give a compelling case that I believe that's going to happen. But what I can't do is guarantee it. And people in the medical community are essentially guaranteeing that this vaccine is going to work, and they shouldn't be doing it. I believe that is medical malpractice. Now, one more point before you interrupt me.
The vaccine has worked. We're not predicting it worked.
Yeah, but you don't know the long-term consequences. You do not know.
We do.
That is unknowable. It's unknowable. You can't know this. Not at
in general, as you know, hold on. In general, as you know, the side effects of vaccines, if they're going to appear in the first roughly 2 months. We don't see long-term side effects. Hold on, because you asked me a very specific question.
You're certain this is
we have seen dramatic reductions. It's really astonishing. Science is a wonderful thing.
It's called herd immunity.
Science is really a wonderful, extraordinary thing, and science is our way out of this pandemic. And what has been astonishing to see is the real world and really astounding reduction in the risk of death, hospitalization, sickness, long COVID, missing. All these reasons. As you know, I'm an advocate of COVID-19 vaccination.
I believe,
and it's not because it's not because I'm being paid by industry. I've never taken a penny from industry. It's because I'm a physician, I'm a father, and I'm a professor of global health, and I believe in data. I'm a data-driven guy.
You're repeating yourself.
And I was very excited to come on your show because you asked if I would share data on
so let me ask you this question. Tyler, would you go ahead and play the video clip from Dr. Ezike, please? Because this goes right to the heart of the question. Tyler, can you play that?
Yes, can you see it?
No.
How about now? Let's see.
Yeah. I see it. I can't hear her speak.
I don't see or hear anything.
In terms of definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis.
I don't see or hear anything. Could you just paraphrase? Yes. Can you just paraphrase? I don't see or hear anything. There must be a technical problem.
I will.
What's your question? What's your question?
It's a 30-second clip. I'd like the audience to see it. Then I'll tell you what she said. Tyler, go ahead and play it all.
In hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that if technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Okay, did you hear that, Dr. Yamey?
No, I didn't see or hear anything.
Okay,
what's your question?
I'll paraphrase, and then it'll be in the full podcast when we publish it. That was Dr. Ezike, the director of Department of Public Health. This is from last year, who explained that just because they say someone died with coronavirus, it doesn't mean they died from coronavirus. And
I see. I understand what you're saying. Yes. No, the 680 deaths that I talked about in children, those were killed by SARS-CoV-2, the illness COVID-19. About a third of them, as you know, had no hold on. As you know, you
That
saw
is
the
so not
data.
right.
About a
You should
third of
not-
them had no
you should not be saying
pre-existing
that.
conditions. You saw that about a third had no pre-existing conditions. And what is
No,
something that
did
I
not say
think we
that.
don't, Kip, what we don't talk about enough, and I'm really happy you've raised this, what we don't talk about enough are the inequities in who gets sick and who dies. We know that Black Americans, we know that Latinx Americans and Native Americans, they are more likely to get infected, they're more likely to die. That is also true of children. There's been a disproportionate burden of this illness on minority children. So I think it's really important that in our vaccination outreach, as you know, we make sure that everybody can benefit, everybody can enjoy the fruits of scientific innovation. As you know, Pope Francis called it an act of love. And that's the kind of love that we in the public health community are hoping, to be able to ensure that everybody can partake of the fruits of science. Everybody can get protected, protect their families, and protect their communities. I have to say, when the polio, I wasn't around when the polio vaccine was discovered. Kip, people were hugging each other, and they had parties in the streets. It was amazing, and I have to say, it's been lovely seeing the celebrations and the kind of block parties around vaccination in the last few weeks. Yeah. I'm sure you've been as excited as I have to witness that.
Well, I think it's very odd that the people that are vaccinated are also double masked and wearing masks in their car and in their home because they're so worried about getting it. I think that's very strange.
It's a very good question, Kip. I'm pleased you asked me that. And in fact, it's a reasonable thing to ask. As you may know, Duke University has a vaccine mandate. And a lot of folks have said, well, if everybody's vaccinated, why are you also masking? And that's a very good question, Kip. I'm pleased that you raised it. Very good question. For that. And let me just explain what the rationale is. And I agree with you that we won't need to be masking forever. But let me just explain the rationale. A few weeks back, we had an outbreak here on campus with almost 400 people infected. Mm-hmm. Mostly vaccinated.
Everybody vaccinated.
Hold on, no, not everybody, but most people. People didn't get sick.
94%.
Hold on, can I just explain? People didn't get sick. They didn't get symptoms. A few got just a cold or whatever. The vaccine worked. The concern wasn't those folks. The concern was our community. We didn't want to contribute towards driving COVID-19 into our beautiful Durham community. We're not distinct from them. We're not hermetically sealed.
But Dr. Yamey, look
and then we also hold on. Let me just finish. And we also have hold on. As I said before, there are students and staff. I know this who have had kidney transplants or rheumatoid arthritis or who are immune compromised. And this happened at a time when kids under 12 had still not had access to the vaccine. So for all those reasons, we have been masking. The wonderful thing about masking is, and we're the only university, I think, that has this data. I can get back to you on that, but I'm pretty sure it's true. I think we are the only university in the country, if not the world, and we're very, very lucky, we're very privileged, to do genetic sequencing on every single confirmed case. We're doing that, and partly because it gives us incredible knowledge of how this virus is transmitted. And what we have found, it's really extraordinary, is we have not documented a single case of classroom transmission with universal masking. We added filtration. Now we have vaccination. It's about layers of protection. But you're right, Kip. We need to start defining what are called off-ramps. You may have heard this expression, off-ramps. When is it that we can unmask, for example? And we are in the process now of defining what those off-ramps might be. Maybe it's a combination of what percentage of people are vaccinated, together with how much we've driven down community transmission. If there's very little SARS-CoV-2 being transmitted in your community, and a very high percentage of people are vaccinated, then you can start thinking about off-ramps. But we've still got a huge proportion of unvaccinated Americans who are at high risk of sickness and death.
You're living in a bubble, my man, because listen, in Texas here and in Florida, other states, we barely even noticed coronavirus. I've worn a mask 4 times the entire time. Okay.
Yeah, but Florida
people-
has been one of the
please,
hardest. Florida's been very
please,
painful. It's been
please,
so painful
very
to watch.
painful, very painful.
Painful
What
to
happened
watch the
in
deaths.
What happened was
The explosion of deaths in Florida. Honestly, I was in tears when I saw the explosion of deaths in Florida.
I'm sorry, but you're in a
You
bubble.
saw the Florida deaths. It was really quite something. I think, again, leaving aside politics, Ron DeSantis, you know, adopted
Oh
an
my goodness.
unusual
Wow.
set of policies.
Wow, you are.
And watching death rates, including, as you know, in nursing homes, it was really painful. I was in tears watching the extraordinary explosion of deaths in Florida.
Well, that's another very sad topic of New York. Again, blue states did that. Very sad topic. Okay, we're running out of time.
We are. I've got to go and pick up my kid from school in 7 minutes.
I know. That's why I want to finish this. And again, I know this has been back and forth. I think this is really healthy. I think people are going to enjoy this on both sides. I really think this will be great. And again, I do appreciate it. I don't mean to be coming across as rude, and I'm sure I do. But
I mean, Kit, as I said, I wanted to come on this podcast. I've never been on a podcast like this before. You know, I've never been interviewed by a Trump booster and supporter. I wanted to reach your listeners and readers and viewers with good, solid, science-based information. I'm grateful to have had that chance. I wish it had not been adversarial. You had agreed that it wouldn't be, and I'm not quite sure how we got there. And I wish you hadn't.
I think a
medical
good
malpractice stuff, filibustering stuff.
debate.
That was unfortunate, Kit, because you and I both want the same thing. We want people to be safe. We want our boys to be safe.
You have been well,
and we have that in common. And so I'm pleased that I had the chance. I wish it hadn't have been so adversarial. Well, thank you for the opportunity.
We're not quite done yet. So Tyler, put up the slide from the Italian Ministry of Health. I really want to get Dr. Yamey's view on this. This was announced yesterday, where the Italian Ministry of Health has dropped their official death count. No, is that it, Tyler? No, the other one.
This is, I can see this time. This is from the QAnon, excuse me, is this from the QAnon magazine, the Epoch Times?
Oh, please,
I would not call this a reliable.
No, please.
I would not call the
There's
Epoch,
no reason.
Epoch
There's no
Times.
reason to go there.
Anyway,
but
look, Kip, I think, listen, I think you have raised
Gavin.
you've raised a very,
Gavin,
Dr.
wait,
Yamey.
you've raised a
Gavin,
very
let other
important,
people talk for a
Dr.
second.
Yamey, please.
you've raised a very important point, Kip.
Please let us speak. Please.
Hold on, I think it's
No, no.
important.
Gavin, you've spoken enough. Give us a second here.
Thank you.
You invited me to
Tyler.
speak.
Tyler, so put up the slide of the Italian Ministry of Health, because this was this is international news. Anyway, bottom line is we're running out of time.
Anyways, okay, run out of time. I'm going to go and get
the Italian Ministry of Health just dropped their official death total from, what was it, Tyler? From what was the total? I don't want to get this wrong.
I have it here. Here we go.
You have it from the
It's
from
not
the Epoch Times. Come on, folks. Hold on.
Tell me the total, Tyler.
Hold on. Can we stop here for a second, Kip? Because this is important.
That's not it.
This is perhaps the most important. This is perhaps the most important thing I'm going to say. Is I think it's really important, extremely important, to look at the sources of data. You saw yesterday the trial in 5 to 11-year-olds was published. It was published in a reputable journal called the New England Journal of Medicine. You saw that the vaccine reduced infection, hold on, by 91%.
Right there it is.
Hold on, and I don't think, just hold on, you shouldn't be getting, just hold on 1 second. You shouldn't be getting information.
It's right there.
You shouldn't be getting information from
130,000 to under 4,000
from the QAnon. Honestly,
from a broadly recognized
the
medical
QAnon magazine versus. I mean, look, you can look at QAnon magazine.
Times, Gavin.
Address it.
New England Journal of Medicine. QAnon.
Shut your mouth for a second.
My point is a really important one, and I think it would actually be a very good thing for your listeners to know that I think it's better to get your. Hold on, Tyler, could you please let me finish?
Enough. We've heard a lot. It's time for somebody else for a second.
Kip and Tyler, you keep saying that I've spoken enough, but you invited me. You invited me to come on your show to talk, and now you keep telling me to stop talking. So, do you want me on your show to talk or not? It's a remarkable experience.
Have a conversation.
My main point is that I do not trust the QAnon. I don't think that you should trust children's Health Defense
One
Fund,
final topic. Here's
Robert
the final
Kennedy
topic we
Jr.,
have to wrap with.
the disinformation
Dr. Yamey, the
dozen,
final question we have to
QAnon.
wrap with.
Don't trust those
So
as
far-
sources of data.
So far,
Okay.
Big Pharma to date has made $250 billion in revenue, and they have no liability. Does that concern you? Does any of that concern you?
So this is, again, Kip, this is something I really hope that we were going to talk about, because I think it's pretty clear that you and I have very different views on many, many things. But I think there is an area where you and I can agree on, and that is the drug companies are not doing enough. You and I can agree the drug companies are not doing enough to make their vaccines freely available around the world. They are putting profit, I would say, ahead of the global public good. Now, you and I know these are profit-making enterprises, right? They have to make a profit. I'm not naive enough to believe that they would do this for love alone. You're a finance guy. You know this, I know this. We know that they have to make a profit. But I would argue right now that the amount of profit that they are making is tantamount to kind of profiteering, pandemic profiteering. I would like to see Pfizer and Moderna and other companies, I'd like to see them share their patents, for example. I would like to see them transfer the technology to low and middle income countries that are hungry to start making the vaccines themselves. They could still be making a decent amount of money and do more to vaccinate the world. There are some countries where, you know, only 2 or 3 or 4% of people are vaccinated, and they are being hit so hard by this pandemic. The bodies are piling high. We as a society need to do better, as you know, on what's been called global vaccine apartheid. And I think companies, I think you and I can agree on this, companies really need to be doing a lot more to share patents, to transfer the technology, and to ensure that everyone, not just the rich world, can enjoy the benefits of protection that the vaccine gives us.
I agree with that.
Yeah, that's it. I've got to go and get my kid from school, or else he won't have anyone to pick him up. Thank you for the opportunity, Kip and Tyler. Nice to meet you both.
Thank you, Dr. Gavin Yamey, Duke University. We appreciate the time today. Hope to see you again.
Bye now.